Hey, good morning. This is Dr. Vanegas from Betalactams Regional. We're going to talk about Betalactams. The first one today is going to be Penicillins. So let's start with the first generation of penicillins, also named natural penicillins. Do you know any examples? We have a PO and an IV presentation. The PO is penicillin B and the IV is penicillin G. What do we use these for, these penicillins? So you're right, we use it for spirochetes, gram-positive cocci, and some anaerobes in the mouth. Very important. What is the drug of choice? From the spirochetes, any spirochete that you can think of? Very good. Penicillin is the drug of choice for syphilis, IV. And also from particular some anaerobes like actinomyces, you can also use it for. And with the gram-positive cocci, you can also use it for Streptococcus pyogenes. Of notice, there is no documentation of pyogenes resistant to penicillins. That's why we can still treat it with this old medication discovered by Fleming. Let's move to the second generation of penicillins, or also named the anti-staphylococcal penicillins. Do you know any examples from it? We have here some examples, PO and IV. In the PO, we put here dicloxacillin and the IV oxacillin. There are other different names like nafcillin, methicillin that we no longer use because of the interstitial nephritis, and also oxacillin. We have a PO and IV. For this particular presentation, we don't want to use only oxacillin because of the better absorption in the belly from dicloxacillin. What do we use it for? As the name says, staphylococcal, we use it for methicillin sensitive Staph aureus. Normally Staph aureus, when they have the penicillin resistant, that's why they no longer use with the first generation of penicillins. We use it now with the second generation. As well, the drug of choice is for MSSA. Very important, these medications, don't use it with food because the absorption is poorly. Okay? Let's move to the third generation of penicillins, the most commonly used, the aminopenicillins. Two examples, PO and IV. PO amoxicillin and IV ampicillin. I know you can also have ampicillin PO, but the absorption in the gut is not that well. So that's why we use these examples. What do we use it for? These broad spectrum antibiotics. So they basically cover gram-positive cocci, like the ones before, and also they cover some gram-negative rods. Specifically, if you add an anti-beta-lactam like clavulanic acid in amoxicillin or sulbactam in ampicillin, then they also cover anaerobes. What is this generation drug of choice for? Very important. Enterococcus and Listeria. And that is why whenever you're suspecting an enterococcal infection or a Listeria, you should use penicillins instead of cephalosporins. Then move forward to the fourth generation and the last one, called the anti-pseudomonal penicillins. Some examples that you may know. One widely known is piperacillin. There are also ticarcillin, but we choose this one because it's the most commonly used. It's only in IV presentation. We don't have PO for a fourth generation penicillin or anti-pseudomonal. So obviously the name itself says it, but what do we use this for? So we have for gram-positive cocci, as the ones before, gram-negative rods, and very important, among the gram-negative rods, they use the space organism. They cover the space organism. As well as the third generation, whenever you add the anti-beta-lactam, in this case is tazobactam for piperacillin, they would also cover anaerobes. And what are the drug choice for? The space organism. And what is a space organism? You may ask, wonder yourself. So S for serratia, P for Pseudomonas, A for Acinetobacter, C for Citrobacter, and E for Enterobacter.